out of that revelation from Mariah Carey. As we told you, she's telling People magazine about her battle with bipolar disorder. Dr. Jen Ashton is here to tell us more about this disorder right now. So first of all, just explain exactly what it is.
So bipolar disorder, it's a mood disorder that is characterized by big swings in your mood, your energy and activity level. And if you look at the juxtaposition here, there's manic episodes where someone feels really up with an increased activity level. Maybe they're not sleeping during the night. They feel super productive. And then a depressive episode where they feel down or have a decrease, kind of the opposite energy level. And the key, George, is that cycling. So if someone has a manic episode, the theory is in some period of time, they will eventually fall down to have a depressive episode, and it's the closeness of that cycling that really determines those swings.
So are there treatments to even things out?
There are, and this is not one size fits all, but the mainstay of treatment is medication. Then there's things like cognitive behavioral therapy, psychoeducation. What does that mean? It means educating the patient about how to recognize their own symptoms so they can get good treatment. Electroconvulsive therapy can be a good option for patients who can't tolerate medication, and the sleep therapy is for when they have these manic episodes, and being deprived from sleep can cause its own set of problems.
When Mariah was first diagnosed, she didn't get treated, and in part perhaps because of the whole stigma attached, but this may help lift that.
Absolutely, and we have to remember, with mental illness and bipolar disorder in particular, there is no shame in this game. Mariah did not come forward really to seek good treatment for herself, and that is not uncommon. And if you think someone with a celebrity with all her resources can be, stigmatized and held back, think what the average person goes through. So, and there's been a lot of data that people have discrimination at work, in their social arenas, and so this is something we need to get past.
But with treatment, the prognosis is good?
Yeah, the key with the prognosis, George, is that when people are feeling good with bipolar disorder, they're much more likely to discontinue or stop their medication. And again, if you go back to that cycling, the key is to keep someone in that middle range where they're the most stable.
More good advice. Jen Ashton, thanks very much.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.